Hi, and welcome back to the Hair Loss Show. In this episode, we're going to do part 2 of our Q&A. So stick around, we'll go through some more questions.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Great, so welcome back. So we're going to go through part 2 of our Q&A. Thanks again for submitting all your questions. And once again, my apologies. We're not going to be able to get through everyone's questions that was submitted, but we've randomly chosen a few, and we'll get through a few in this episode. Right, so Burn the Press has asked, what percentage of patients do you find having to increase finasteride from 3 milligrams a week to daily 1 milligram? And does this correlate with thinning beginning from an earlier age? So, Burn the Press, thank you for your question. The answer is there's no real correlation. Some people just need that small amount of the medication, of the finasteride, and 3 milligrams per week is enough to suppress that level of DHT enough to stabilize the hair loss. Some people need slightly higher doses, whether that's 4 milligrams or daily dose of 7 milligrams a week. It doesn't really correlate to how aggressive that patient's male pattern hair loss actually is. That said, if I have a patient and I start them on 3 milligrams a week and they're still unstable, I will increase that dose up to, say, 1 milligram a day, so 7 milligrams a week, in order to see if bringing that level of DHT down slightly to a slightly lower level does stabilize the condition. But it's not predictive in any way that someone who needs a higher dose necessarily has a more aggressive form of androgenic alopecia. So I hope that answers that question. Next question from Danny. I have androgenic alopecia. It's thinning throughout the top rather than receding hairline. Can you please talk about how the effect of hair transplantation is for my type of hair loss, and are there any differences in transplantation? Thank you. That's a great question. So where the issue is with what Danny has experiencing, or has explained, is that he's maintained the hairline, but he's thinning through the top. Now, we don't know, just based on that description alone, it's either one of potentially two things. So one, it could be that he's described what is an earlier marking out of quite a large area. So it could be that he's Norwood 4 or potentially Norwood 5, but just early on in the progression, that he's marked that area out, that area is thinning and will experience more hair loss. The other thing to potentially consider is that it is a different pattern of hair loss. So some people experience what is known as a diffuse pattern of hair loss, which is not only thinning over the top of the scalp, but also thinning through the sides and the back as well. And how you would approach hair transplantation is different depending on which category it potentially is. If it's in the first category, so it's just an early thinning, then you can transplant into the area. You want to be careful because you don't know there's no way of predicting how worse it's going to get. Certainly, you'd want to stabilize that area, so that patient with medication as well. But if the individual, the patient has marked out the area, then you can go, right, well, we're going to have to surgically plan for that particular area. In the other case of someone who's got a more diffuse pattern of hair loss, it's a little bit more trickier. And certainly hair transplantation is not certainly contraindicated, but you want to be very careful, because by definition a diffuse pattern means that it is affecting hairs over the entire scalp, and therefore any transplantation that you would do, the donor area, the donor hairs that you would use are potentially under the influence of that DHT and potentially may thin and fall out over time. So you may not get the most successful of outcomes. So it's important, if you're in this scenario, to make sure that you are assessed properly. So make sure you see someone, have a consultation with someone, make sure that's assessed, and that you have an appropriate surgical plan put in place. And also make sure you have a full discussion, thorough discussion with regards to medical therapy. So I hope that answers that question. And thanks, Danny, for bringing that to our attention. And so the next question from Sufyan. I was watching the video of using minoxidil post-hair transplant, but my question is, when you stop the minoxidil, is there any chance to lose the new hairs from the transplant, or will they just keep growing? All right, that's a great question as well, and one that we commonly get. Now, again, I come back to the concept of having a hair transplant. A hair transplant is moving healthy hairs from what we call the donor area to the recipient area. Those hairs are nice and thick. They're not under the influence of DHT. So when you move those hairs, you're just changing the geography of those hairs. Those hairs will continue to grow in that thick fashion that they were at the back of the head. So you can't essentially thicken those hairs up anymore. You can't make them thicker than they were at the back of the head. So, but we can and we do use minoxidil post-hair transplantation in certain cases. And where the benefit of that is that it helps speed up the regrowth. Because if you have a hair transplant, it normally takes probably about 10 to 12 months to reach the full effect. But by using minoxidil, it'll actually speed that growth. So you may get to that end point slightly earlier. But it will not change the outcome. You're not going to have a better outcome on the minoxidil in terms of what the final effect will look like compared to someone who doesn't use minoxidil. So Sufyan, yeah, thanks for your question, but you're not going to lose, if you decide not to use minoxidil, you're not going to lose any of those hairs, because those hairs are the healthy hairs that we've moved from the back of the head. So I hope you found those set of questions useful. Thanks again for watching. Please remember to like and subscribe to the channel, and we'll see you on the next episode, and we'll go through some more Q&A. Thanks very much.